As part of efforts targeted at ensuring that the aged and people with disabilities are not left behind in the implementation of the SDGs, the Senior Special Assistant to the President on SDGs is working out a strategic partnership with the United Nations Department of Social Affairs. The revelation was made when the UN team paid a courtesy visit on the office in Abuja recently. The report.
The meeting by the United Nations team was to seek areas of cooperation in the quest to addressing the prevailing challenges of the aging population in the society. The Senior Special Assistant to the President on SDGs, Princess Adejoke Orelope Adefulire, who was represented by the Secretary of Program in the office, Waziri Laminu, told the visiting UN team that the number of challenges confronting aging persons in Nigeria are numerous, hence the need to take the issues more seriously. He gave assurance that the office and indeed the government of President Muhammadu Buhari will continue to give more attention to the issues surrounding the aging and people with disabilities as part of efforts of the government to ensure that no one is left behind in the implementation of the SDGs.
We are delighted to receive the UN team, and we have given them assurances that we've always been working towards getting a cross-cutting approach to the issues of aging, disability, gender, and the rest of them.
Rosemary Lane, the leader of the United Nations Department of Social Affairs team, pledged full assistance in making sure that the aged in Nigeria are well attended to and integrated into the society.
You know, as we discuss from our perspective and what our department offers, certainly the capacity building of the staff on mainstreaming aging, disability, and all these issues that our office deals with, actually not just aging, into the work of the implementation of the SDGs, monitoring and evaluation at the state as well as the federal level. I think that's clear that's off the top of my head. I can see immediately where we can offer assistance. I think we have to study other avenues that were discussed, but that clearly is the low-hanging fruit, so to speak, that we can, clearly help with immediately.
In her remarks, the leader of Dave Omokaro Foundation, Emeru Omokaro, noted the widespread lack of understanding and poor knowledge of issues bordering on elder persons, hence the need to create awareness. She therefore sought the collaboration of the SDGs office in tackling the issues.
As we have a desk on youth, and we have a desk on gender, and we have some other desk, I want to plead, there is need for a desk on aging and older persons. And you will discover that if you create that desk, you see that you have cross-cutting issues that you get to understand better.
Delivering the official remarks of the office, the head of sectors in the SDGs office, Pharmacist Yahya Hamza, gave a breakdown of efforts made so far in attending to the issues of the aged in Nigeria and also reeled out the areas of challenges and that which needs support from the UN delegations.
With the 2030 Agenda's commitment to leave no one behind, the SDGs clearly identify older persons and persons with disabilities as an integral part of development. The older persons are confronted with a number of challenges which include poverty, access to basic healthcare, issues of abuse, rights violation, non-inclusion, etc. A key initiative being executed under the MOU is the provision of free legal services for the underprivileged and vulnerable groups, especially the aged and rural women in cases of gender violence and violation of human rights. Aging issues is cross-cutting in the SDGs and is crucial to achieving the SDGs and ensuring that no one is left behind. As a coordinating office for the SDGs implementation in Nigeria, we have identified the following as areas for support. Bullet point 1, capacity building for developing policies on aging. 2, healthcare services and social protection for the elderly. 3, strengthening the National Bureau of Statistics and other ministries, departments, and agencies on data collection, collation, and utilization on aging-related issues, and also the National Population Commission to collect disaggregated population data. 4. Sensitization and advocacy on the need to include older persons in the planning and implementation of age-responsive policies. 5. Sensitization and advocacy on the need for legislation to protect the rights of the elderly and vulnerable.